Can you speak about how involuntary treatment, in terms of being culturally safe for Indigenous people and patients, and maybe is there concerns that involuntary treatment of Indigenous patients could compound intergenerational trauma arising from residential schools and colonization?
It's a great question. I would say that in my experience, and to sort of clarify my experience, I trained in a family medicine program specific to serving the Indigenous populations, and my family practice is specifically serving urban Indigenous populations in Winnipeg. And so one of the things that I see in my patients is that even voluntary admission to hospital is sometimes perpetuating intergenerational trauma for a variety of reasons. Any institution where people have less power over their decisions has the risk of re-perpetuating trauma. And that would only be escalated in the context of involuntary treatment. I have had patients express to me their concerns about being involuntarily admitted under the Mental Health Act, and how that has perpetuated trauma. And at the same time, sometimes it's necessary. And so it is important that when we look at involuntary treatment to any degree, including that sort of coercive involuntary assessment that should be part of a decriminalization policy, we need to do so in a way that is informed by people who use drugs, and that is informed by people who are Indigenous and by minority groups that may be at higher risk of harms related to those policies.